Have you ever felt worried when your blood sugar spikes after meals? Or perhaps you've experienced the panic of waking up to find your fasting blood sugar higher than usual? I completely understand these concerns because I have a family member with diabetes. And I've witnessed firsthand the daily struggle of monitoring blood sugar levels, constantly wondering what to eat and what to avoid. But here's some truly hopeful news I want to share with you today. According to recent research published by Harvard Medical School, implementing the right exercise methods can stabilize blood sugar levels by up to 40%. Isn't that remarkable? This means we can awaken our body's natural, healing abilities to control blood sugar without relying solely on medication. In fact, a large-scale clinical trial, conducted by the American Diabetes Association, followed 300 diabetic patients through a specialized exercise program for 6 months. The results were absolutely stunning. Participants saw an average reduction of 1.2 points in their HbA1c levels, and their fasting blood sugar decreased by an average of 35 mg/dl. These results are comparable to medication-based treatments. So what exactly are these exercises that produced such amazing results? Simply telling people to exercise can feel overwhelming and vague. This is especially true for those with diabetes, who must be extra cautious since the wrong type of exercise could actually raise blood sugar levels. Today I'm going to introduce you to 6 specialized exercise methods, designed specifically for blood sugar stabilization. These exercises have been researched and validated by diabetes specialists and exercise physiologists over many years. They can be easily performed at home, require no special equipment, and are structured progressively, so anyone can practice them regardless of age or fitness level. The first exercise I want to share with you is post-meal walking. You might think this sounds too simple to be effective, but this is actually one of the most powerful blood sugar control tools available. Research from the University of Exeter in the UK shows that just 15 minutes of gentle walking after meals can suppress blood sugar spikes by 30%. The key here is timing. Starting your walk within 30 minutes after finishing your meal provides the most effective results. This is because blood sugar rises most rapidly during this time frame. Walk at a pace slightly slower than your normal walking speed, at a conversational intensity, where you could easily chat with someone. If 15 minutes feels overwhelming, start with just 5 minutes and gradually increase the duration. Diabetes clinics that recommended this method to their patients reported an average reduction of 28 mg/dl in post-meal blood sugar levels after 2 hours. It's truly amazing that such a simple approach can yield these kinds of results. The second exercise is stair climbing. If you have stairs at home or can access apartment building stairs, this is an excellent workout option. Research from the University of Copenhagen in Denmark found that climbing just 3 floors of stairs daily can improve insulin sensitivity by 15%. The advantage of stair climbing lies in its ability to effectively stimulate muscles in a short period. The large muscle groups in your thighs and glutes actively move, consuming glucose for energy. However, there are important precautions to consider. Don't overexert yourself initially, and climb 1 floor at a time slowly. If you become very short of breath or feel chest tightness, rest immediately. Here's the safe approach. First, climb 1 floor and rest for 1 minute. Then climb to the second floor and rest for another minute. Continue this gradual progression. After about a week of adaptation, you should be able to climb 3 floors continuously without difficulty. The third exercise I want to introduce is chair squats. This is particularly beneficial for those with weak knees or arthritis. It's much safer than regular squats, while providing nearly equivalent effectiveness. Research published by the American College of Sports Medicine shows that performing just 10 chair squats in 3 sets daily can increase muscle mass by 8%. This boost in muscle mass elevates your basal metabolic rate, significantly improving blood sugar control capabilities. Remember, muscle tissue is your body's largest glucose consumer. Here's how to perform chair squats properly. Stand in front of a sturdy chair with your feet shoulder width apart. Cross your arms over your chest or place them on your waist. Slowly lower yourself as if sitting down, pushing your hips back until your bottom lightly touches the chair, then immediately stand back up. The key is not to fully sit down, but to stand up the moment your bottom touches the chair. Start with 5 repetitions and gradually increase. Aim for 10 repetitions after 1 week, and 15 repetitions after 2 weeks. Focus on slow, controlled movements with proper form rather than speed. The 4th exercise is wall push-ups. If regular push-ups seem too challenging, this method is perfect for you. Using a wall allows you to adjust the intensity according to your fitness level. Why are upper body muscle exercises beneficial for blood sugar? Research from Johns Hopkins Medical School indicates that upper body muscle exercises can improve insulin sensitivity by up to 23%. When chest, shoulder, and arm muscles are activated, glucose uptake is enhanced. Here's how to perform wall push-ups. Stand at arm's length from a wall. Place both hands against the wall at shoulder height, shoulder width apart. Slowly lean your body toward the wall, then push back to the starting position. Keep your body in a straight line throughout the movement. The farther you stand from the wall, the higher the intensity. The closer you are, the easier it becomes. Start close to the wall and gradually increase the distance. Aim for 10 repetitions in 3 sets. Though starting with just 5 repetitions is perfectly fine. The 5th exercise is marching in place. This is incredibly useful when weather is poor or going outside isn't feasible. Research conducted at Mayo Clinic found that 10 minutes of marching in place provides similar blood sugar control. Benefits to a 30-minute walk. The key to effective marching in place is lifting your knees high. Your thighs should reach parallel to the floor for maximum effectiveness. Swing your arms naturally and maintain a rhythmic pace. Adding music can make this exercise more enjoyable. Start with 3 minutes and gradually work up to 10 minutes. If you become short of breath, take a brief rest and continue. The most important aspect is consistency. The 6th and final exercise combines deep breathing with stretching. While exercise is crucial, stress management is equally important for blood sugar control. Chronic stress triggers cortisol hormone release, which continuously elevates blood sugar levels. Harvard Medical School research shows that combining deep diaphragmatic breathing with stretching for 15 minutes daily can reduce stress hormones by 42%, resulting in an average 18 mg/dL reduction in fasting blood sugar. Here's the method. Sit or lie down comfortably. Place one hand on your chest and the other on your abdomen. Slowly inhale through your nose, allowing your belly to expand while keeping the chest hand relatively still. Then slowly exhale through your mouth while pulling your belly in. Include gentle stretches for your neck, shoulders, and arms during this process. Now you're probably wondering how to combine these 6 exercises effectively. Trying to do everything at once can feel overwhelming and become difficult to sustain long-term. I've created a 7-day progressive implementation plan. On days 1 and 2, focus only on post-meal walking for 15 minutes. Or 10 minutes if that feels more manageable. Starting day 3, add 5 chair squats. From day 5, choose either wall, push-ups or stair climbing to add to your routine. After 1 week, you can begin mixing all exercises throughout your day. The most crucial aspect is observing your body's responses carefully. Check your blood sugar before and after exercise to determine which exercises are most effective for you personally. Generally, blood sugar drops most significantly between 30 minutes and 2 hours after exercise. However, there are important precautions to consider. If you're taking insulin or blood sugar medications, having a light snack before exercising is advisable. Exercising on an empty stomach can potentially cause hypoglycemia. If you feel dizzy or break out in cold sweats during exercise, stop immediately and consume some sugar. Additionally, if you have foot wounds or diabetic neuropathy with reduced sensation, pay special attention to foot care. Examine your feet thoroughly before and after exercise and wear Comfortable athletic shoes. Avoid barefoot exercises. If you have heart disease or high blood pressure, alongside diabetes, increase exercise intensity even more gradually. Stop immediately and consult a healthcare professional. If you experience chest tightness or breathing difficulties during exercise, safety must always come first. I genuinely support your journey toward healthy transformation. Starting today, begin with one exercise at a time, step by step. Within a few weeks, you'll notice not only changes in your blood sugar levels, but also increased physical vitality. Until healthy habits become part of your daily routine, I'll continue bringing you helpful information. Blood sugar management doesn't have to be frightening anymore. You absolutely have the capability to succeed. Today marks the beginning of your fresh start. Please help others access this information by subscribing and liking this video. Let's protect your precious health together.